Let's answer the question, how do I improve gut health? Well, I tell you, let's first define what the gut is. Now, the gut is really one big long tube all the way from your nose, your mouth, all the way down to your behind. The stomach is just part of that. Small intestine, large intestine, just part of that tube. And this tube is very important. It determines what's going to get inside the rest of our body from the outside world or what might not. So the skin, of course, keeps outside world stuff in that shouldn't get in. The tube, nose, mouth, all the way down to the behind, also interacts with the outside world. Anything that gets on our nose and mouth, it's being swallowed, it's going down all the way potentially out the other end. And so this is where the health of nose, mouth, entire tube is so connected to the actual intestines themselves. And so in clinic, we talk a lot about the intestinal microbiome, the mix of the good, bad bugs in the gut. But every body part has its own unique microbiome. So the palm of your dominant hand's microbiome is different than the palm of your non-dominant hand's microbiome. Back of the hand, different than the palm. Elbow crease, different than your axilla. Every part has its own microbiome. Now, in women, the intestinal microbiome is almost identical to the vaginal microbiome, the vaginal vault microbiome. And let's talk about that a little later. But that's a fascinating, there are two parts of the body with the same microbiome in women. So this is where oral health is intimately connected with the entire gut health. So when you get gum disease, cavities, this kind of thing, it's because of a disrupted oral microbiome. There's a mismatch of the good, bad bugs in your mouth. And this is where you hear things like, oh my gosh, I floss and brush regularly multiple times a day, and I still have gum issues and get cavities. Or you hear somebody else say, oh, geez, I know I should brush more and floss. Again, I know I should probably floss, but I've never had a cavity before. And so the oral microbiome is a lot more than that kind of daily habit. But this is also where, when the disrupted oral microbiome, too many bad bugs, not enough good, creates the oral disease, it increases your risk of heart attacks and strokes and Alzheimer's, because the bad bugs in the mouth get through the cracks, the openings between the gums and the teeth into the bloodstream, go all over the body, creating chronic inflammation, creating chronic disease. Now, when the intestinal microbiome, good, bad mix, is disrupted, creates gut issues. And many people hear leaky gut. Well, what does leaky gut mean? Well, in your intestines, some things should get through the wall to the rest of your body, the bloodstream, and all the other organs, vitamins, minerals, proteins, fatty acids, all these nutrients your body needs to make things, fix things, be happy and healthy. But when you get a leaky gut, an intestinal permeability disorder, the tight junctions that are super tight, they're not going to let anything in from the gut to the bloodstream that shouldn't get there. They get leaky, right? Disrupted tight junctions. And stress can do this. All the NSAIDs, Motrins, Advils, all these kind of things. Acid blocking medicines can do it. Antibiotics can do it. Other medicines can do it. And then things that are in the intestine can get in the bloodstream. They should, including adenoviruses. One of the common ones we always check for in the blood test is Coxsackie virus. Adenoviruses get in the bloodstream, go to their body parts, create difficulties. So they talk about the translocation of bugs from the gut through the leaky gut to the rest of the body parts, driving chronic disease. We just did a video talking about the intestinal microbiome breast axis. Translocation of bad bugs from the gut get up to the breast, increase breast cancer. Type 1 diabetes, translocation of viruses such as adenoviruses, Coxsackie virus B as in boy, B4, translocating from the intestine to the cells in the pancreas that make insulin. They stop making insulin, type 1 diabetes. So you don't want leaky gut. You don't want leaky oral microbiome. So what we need to do is optimize the intestinal microbiome. Now, build up the good, yes, get rid of the bad. But one of the common bad bugs that get into the gut and create issues, including the intestine, is candida, mold, yeast species. So one of the challenges is mold's everywhere, right? It's everywhere in our outside world. It's in houses and hay bales and barns. It's in the air. People have mold allergies. It's in food and water. Up here in the mountains of Idaho and Jackson, Wyoming, this kind of stuff, they have something called snow mold. So as the snow melts, there's mold under the snow. Snow melts, it is just covered with mold, just a blanket of mold. And boy, we're having an unusually warm winter here. So the snow we had before Christmas, between Christmas and New Year's, is melting. I went out to take the garbage out the other day. I'm like, oh my gosh, that putrid, almost smelled like somebody left the gas burner on, but it was more putrid than that. That's that snow mold. And patients complain about it all the time. Some people more sensitive than others. So this mold's everywhere. It gets in your nose and your mouth, right? And some people are so sensitive to snow mold or other mold that they go, wow, this really bugs me. Or I can smell mold. If I walk into a house, I know if there's mold here, kind of a thing. And so it sits there. Most people, no big deal, it just sits there. People that are very sensitive to it might start irritating. Oh, my sinuses are all irritated, my throat. But yeah, most people aren't super sensitive to it, so it just sits there. But we swallow it, right? So the little hair's nose pushes it back. We swallow it, and gets to our stomach. Oh, no big deal. Our stomach is just full of hydrochloric acid, right? Super low pH, more acidic, lower pH than even battery acid in our cars. It's very acidic because it's supposed to digest foods. Proteins, fats, carbs get digested, broken down as part of the multi-step process of digestion. Beautiful. But also this super acidic environment is designed to kill any bad bugs. They're trying to get from our outside world, nose, mouth, down to our intestines, or even into the gut to create disease. But when you're on medicines that block stomach acid production, you're very stressed. When people are stressed, they don't make stomach acid as well. That's why it's so hard to digest foods when we're all stressed out, right? There's not the stomach acid. It's not the low pH environment. You're not digesting your foods and getting the nutrients out. You lost one of the major steps in digesting food, but now bad bugs like mold, candida is one species, can get to the intestines. And if you already have a disruptive intestinal microbiome, it's easy for a bad dude to set up a happy home and start creating all this stuff, including eventually get from the gut through the leaky gut into the bloodstream, go all over. The classic sort of 6 signs of systemic candida, systemic mold that's gotten all over the system is joint pain, muscle pain, brain fog, fatigue, sinus issues, and weight gain. Know anybody with any of those things? Know anybody with all those things? Do you know anybody without all those things? It is so common. And if you're somebody that goes, oh my goodness, when I eat sugar, I eat simple carbs, I feel worse. You're feeding mold. Mold is on sugar. You're feeding the mold. You feel worse. You got mold. You know you got mold. If you say, oh my gosh, I think I'm a weak person because I cannot say no to sugar. I just crave sugar. You got mold. The mold's telling you to eat sugar because the mold will feed the mold. They stay alive. They want you to keep eating to stay alive, but you're getting all this inflammation from this chronic infection, right? So, classic thing we see oftentimes in clinic is people with chronic sinus issues, chronic sinusitis. Oh, my sinuses are just always irritated. I think it must be allergies. It's year round, all this kind of stuff. Well, it could be allergies, right? You could be, allergic to things, but it could be a chronic smoldering mold infection in your sinuses, creating chronic smoldering inflammation. All my sinuses are just a mess. They're always inflamed, runny nose, postnasal drip, all this kind of stuff, itchy. Well, what you tend to see in this situation also is people will say, geez, I keep getting sinus infections and I need an antibiotic. And then that makes it better gets rid of the infection, but I still have all the sinus stuff and still all irritated because I have allergies probably. But then the bacterial infection comes back. Oh, no, I got a sinus infection again, bacteria. I take an antibiotic, gets rid of bacteria. Infection, antibiotic, infection, antibiotic. Well, oftentimes what's happening is this chronic smoldering mold infection in your sinuses is creating chronic inflammation, disrupting the tissue, the mucous membranes, makes it very easy for a bad bacteria from our outside world to jump on top and create a infection where your sinus symptoms get worse than they are day in, day out. Use antibiotic, gets rid of the bacteria, does not get rid of mold. The mold stays there, you got this chronic inflammation. Oh, I got a sinus infection again. That's when the bacteria jumping on top, and now it got worse again. Antibiotic. So we go, oh, you get these chronic recurrent bacterial sinus infections with sinus issues between times. You got a chronic smoldering mold infection. Even if you get a sinus surgery to open up the passageways, that's not even going to get rid of the mold, and you still have sinus issues. Oftentimes, we'll see people with 2 sinus surgeries, and they still got sinus issues because they never got rid of the mold. Just by opening up the passageways doesn't get rid of the mold, right? And so, but when it's in your nose, things go back the back of your throat and you swallow. Well, back of the throat connects to the mouth. People can get chronic smoldering mold candida infections of the mouth too. Oh, that thick white coat on my tongue. I wonder what's doing that. Oh, I got this. I'm always like kind of a thing. I always got something caught in the back of my throat, or it might hurt, or it itches. Um, Gum disease, right? Because mold's a bad bug for the mouth. Gum disease. Well, if you got overgrowth of mold in your mouth, disrupting the environment, it's going to be easy for bad bacteria to come into the oral microbiome and then try to get in to the bloodstream, go create the heart attack, stroke, and Alzheimer's risk. But then you swallow the mold, the candida goes on your stomach. Stomach acid's going to kill it. It's more acidic than battery acid, no big deal. Except if you don't have great stomach acid, you're on the acid blocking medicines, you're stressed, all these different things. Then it gets past the stomach down into the small intestine, the large intestine. Now it can set up a happy home down there. And then that is a very common chronic infection within the small and large intestine. That kind of gut that usually people are referring to when they say gut, they're kind of talking about the intestines, when we now know that the gut is really one big long tube that goes from your nose, mouth, all the way down to your behind. It's all connected. So we optimize the oral microbiome. Then your oral cavity is much healthier. Gingivitis goes away. The sores on your gums go away. And you're not kicking bad bugs into the bloodstream. You fix the oral microbiome. Then you don't have bad bugs you're swallowing all the time. Makes it easier to fix the intestinal microbiome, but we also know that the intestinal microbiome is intimately connected with the microbiome of all our other body parts. We talked about the breast tissue. We talked about the pancreas and the beta islet cells that make insulin in the pancreas, but also that helps with the oral microbiome, that helps with the sinus microbiome, right? So you finally get rid of that mold in the sinuses. You go, oh my goodness, that wasn't allergies. That was just inflammation coming from a chronic infection. Then bacteria don't jump on top because they can't, because it's a healthy environment. You don't get bacterial sinus infections and antibiotics anymore. But then this is really helping a lot with your digestion too, right? So digestion is a multi-step process. First thing you do, you put food in your mouth. The saliva creates a chemical breakdown of the food. This is why when you have dry mouth, because of so many medicines give dry mouth, for example, or autoimmune disease can get dry mouth, but classically it's these medicines that give you a dry mouth. You don't have saliva, not very good for oral health, right? But it is impossible to start digesting your food. If you miss that chemical breakdown of the food to start with, none of the other steps are going to be able to do their work because the food wasn't properly prepped as far as the digestion process by the saliva. Then you got your teeth, mechanical breakdown of your food. Step 2, saliva and teeth, kind of a combo there, but they're both very important. Chemical breakdown, mechanical breakdown. But people may have bad teeth. I really can't chew my food very well because my teeth hurt, all this kind of stuff. Oh boy, I got dentures and I can't really chew my food very well. So you need the chemical breakdown, you need mechanical breakdown of the teeth. Then it gets down to the stomach, and then you have the hydrochloric acid. Now you have chemical breakdown again, but the stomach is never going to be able to digest and do its work like it's supposed to if the first two steps are not done well, right? They got to break it down to a form, foods in a form that now the stomach hydrochloric acid can do its work. It won't do the work if the other steps are not done. Then it gets past the stomach, starts going into the intestine. Well, now the intestines start breaking things down, bile acids, pancreatic enzymes, all this kind of stuff. Well, they're not going to be able to do the job they need to if the other steps haven't been followed first. And then you end up with this food in your intestine that's supposed to be in a form where you can actually absorb the nutrients from it. It's not going to be in that form. You're not going to be able to get those nutrients from your food in because the multi-step process was thrown off either one, two, or whatever, including the very first steps. But then, I hope I don't gross anybody out with this, but then you got undigested foods sitting in your intestines, right? Your large intestine, let's say. And you don't want to have undigested fats and proteins sitting in your intestine. They just sit there and they go bad. They are going rancid and they're putrefying right in your intestine. So think of it this way. It's kind of gross. You come home from the store. One of the things you bought was a well-marbled steak. Okay, you take everything out of the bags, you got on the counter. Now I'm going to put stuff in the refrigerator or the freezer. Well, here's this well-marbled steak, protein, the red part, white, the fat part. It gets behind the cookie jar. You don't see it. And it sits behind the cookie jar for a couple days. Well, a couple days later, not too long, you come walking into your house, the most terrible smell in the world hits your nose. It is so terrible. You're not thinking, oh, geez, I wonder what that is. What does that smell? Huh. You're not going to think it's snow mold because snow mold's not even that bad. Huh. You don't do that because you go, oh my gosh, nothing smells that bad. Something went bad. Something has gone rotten. You go, you find it behind the cookie jar, like, oh my gosh, I forgot to put this in the refrigerator. That protein and fat has gone rancid. It is putrefying right on the counter of your kitchen. It smells so bad, you put it in the garbage in your kitchen, right? It smells so bad, this rancid, putrefying fat and protein, you can't keep it in your kitchen garbage can. You got to take it out to the garage and throw it out there because it stinks too bad, right? Well, that's the exact same thing that happens in your intestines when you have rancid, putrefying fats and proteins right down there. And the chemicals that it creates on your counter that hit your nose and you go, oh my gosh, well, those are the same chemicals that are being created in your intestine by the rancid, putrefying fats and proteins. Yuck for your gut. What gut's going to be healthy and happy with all that stuff? But, and it's kind of the gross part, the leaky gut. They don't stay in the gut. They leak into the bloodstream, go all over the body, creating inflammation. One bad protein that's in the gut, not really tied into this rancid putrefying food you can't do, but there's a protein on gram-negative bacteria in the gut called LPS, lipopolysaccharides. These LPSs need to stay in your gut. They don't stay in the gut when you got a leaky gut. They leak from the bloodstream, from the gut in the bloodstream, they go all over the body. Now, the first thing I read about these LPSs going outside of the gut was they go to the brain, right? So a leaky gut creates a leaky brain, a leaky blood-brain barrier, right? So there's two really big barriers to keep things in one place and not let it get to another thing. So one of the barriers is the intestinal wall. There's things in your gut that you do not want into the bloodstream. There are things in your bloodstream you do not want in your brain. That's the blood-brain barrier, right? But when you get a leaky gut, it creates a leaky blood-brain barrier. Things get to the brain you don't want to get from the bloodstream to the brain. So these LPSs would translocate. We're going to use that word again. Translocate from the intestine in the bloodstream, then translocate past the leaky blood-brain barrier into the brain. And they would go to certain brain structures typically, and these brain structures would shrink. Rule of thumb, you never want to shrink brain structures. Counterproductive to shrink brain structures. This is what happens, including really important brain structures for a lot of stuff, cognitive, emotional kind of stuff, including impulse control, saying no to things that you know are going to be bad for you when you should. So this is a big driver of addictions, right? Addictions are, you can't say no to things, the impulses, to things that are going to hurt you. Well, I know this is not good for me. I know I shouldn't do it, but I can't say no. Okay, addictions. And so this is one reason why doing only counseling and group therapy and all makes it really tough to keep people off things they're addicted to, because they've actually shrunk brain structures involved in impulse control. And I go, oh my gosh, that makes so much sense. Of course, people have a hard time saying no to addictions. But also I'm thinking, well, this is not, people don't become addicted to things because of, weak personalities, or they're not a strong person. Their brain parts are shrunk, right? Their brain parts are, they can't say no to things that are going to hurt them. So you got to fix the gut, got to fix the blood-brain barrier. The brain structures have been shown to be able to regrow again. And then it's always nice to have your brain the size it's supposed to be, not shrunken. But then you regain your ability to say no, impulse control, it comes back, as well as other brain functions. So the next thing I read was, well, this gets into the bones. These LPSs get into the bones and drive osteoporosis. Oh, that is so cool. They create all this inflammation wherever they get to. They create osteoporosis. And this is where we did that one video talking about pregnenolone, the supplement, the hormone that we use a ton. Pregnenolone supplementation gets to the bone, is able to undo the inflammation created by the LPSs that are creating osteoporosis, right? No amount of calcium is involved in this process. That's a very common process to drive osteoporosis. Then as I'm doing some deep dives, well, these LPSs go to the breast tissue, create breast inflammation. Intestinal microbiome, breast axis, these LPSs go all over the place and create inflammation, create chronic disease. So there's definitely things in the gut that you don't want to get through, but these undigested proteins, undigested fats in the gut, they're going rancid and putrefying. Yeah, they're making chemicals that irritate the heck out of the gut, get into the bloodstream, but they're the ones that contribute to the leaky gut as well, right? So if you don't digest your food well, you have undigested food in your gut. Well, that alone can create this leaky gut that creates all this kind of stuff. So whether it's the gut, nose, mouth, all the way down to your behind, multi-step digestion process, whether it's that microbiome, nose, mouth, all the way down to your behind, super central mechanism for all this stuff. This is where the gut is so much more than just a small intestine, large intestine, or just a stomach, or just an esophagus. It's like top to bottom, and it all is communicating, and it's all playing a part in whether you have gut symptoms, sinus, mouth, all the way down to behind, or you have systemic inflammation outside the gut. It is all connected. And don't forget about the immune system that surrounds the gut, 80% surrounds the gut. So then we get the whole immune system tied into all this kind of stuff. And of course, I love to talk about the immune system, but we spent most of our time today talking about the gut, top to bottom.